Hey guys, so today we are going to talk about the TMJ and how it's so mismanaged. I know we say this all the time, like our back pain is so mismanaged, our neck and shoulder pain are so mismanaged. Well, the TMJ joint really is another one that is really mismanaged, and not a lot of people know how to treat it, which is why we get people that come into our office and they say things like, yeah, the doctor said I just had to live with it. Like, that makes me feel good. Like, I'm supposed to be exhausted for the rest of my life because I'm hurting. Like, that doesn't seem like a normal process. Or they give you a mouth guard and it doesn't work. And you're like, there's nothing else I can do. And it's just not true.
To the point where people don't even bring it up. Like, they're like, I have to ask them, oh, do you have any issues with your TMJ? And they're like, oh, well, yeah, kind of like counting it out. Like, and I think a lot of that is too, is they don't know that physical therapy treats the TMJ just like it's any other joint, because it is.
Yeah.
So, patients won't even bring it up until I kind of say, okay, you got some neck pain. It's really high, it's high up in the upper cervical spine. It's very closely related to your jaw.
Yeah.
So I ask the question and then they're like, yes, I do. How'd you know? And it's, we see it a lot. But most of the time patients don't come in saying, I have a TMJ issue. It's other things are going on. And then we kind of uncover it. But we want people to know that, like, we're here to help you with TMJ and we can help you. So you can come to that as your primary source for that.
Yeah. And doctors don't know either. So they're never going to send you to physical therapy.
Yeah.
Ever going to do physical therapy. It's not going to be even on their list to think of what they can do. So really you have to be your own self-advocate, which is why we're getting information like this out to people, because I can't tell you, I mean, even on social media, people are like, oh my God, I didn't even know there was any other things that we could do. Like, I'm so glad that we found you. Like, these are the things that we're hearing all the time. And it's just really sad. So this is just an educational piece that we want to get out to people, and we'll make it short and sweet. So what are some of the common treatments that are not working?
So patients will get Botox in their masseter muscle here, which is very temporary. It's just shutting your muscle down completely. And that will help for a little while, maybe. But then I have patients who are like, yeah, I did Botox for a while, and they spend so much money on it. And then it wears off and it doesn't even work as well each time they get it. It kind of doesn't work as much as it did the first time. So that's not going to solve, it's not going to get to the source, it's not going to solve the problem. Another thing are mouth guards. So dentists will give you mouth guards with the way that your jaw is set and the way that your bite is, and not change that and just give you a mouth guard. And it's honestly, a lot of times doesn't prevent all the clenching and biting. And patients will say, yeah, I mean, I think I still bite on my mouth guard. I have marks on it. So they're still clenching. Sometimes it works and sometimes it's great, but you just really have to make sure that that's what you need and that you have the right fit for you. So knowing that you're going to the right provider for that. Pain medications and even surgery. So you can get injections and take pain medications, muscle relaxers, all that. Doctors will just prescribe, and it's just, again, not going to get to the source, just like any other body part. And then do not get jaw surgery. It's the most miserable thing you could do. It's not going to help. And I mean, you can't eat for like months. They break your jaw. You don't need it. There's so many things that you can do before jumping to that surgery. I mean, if you get in a car accident and yes, your jaw, it's like an acute injury, maybe you need it, but it's just kind of a last resort type thing.
Yeah, for those people that I'm not really sure what I did, it's just been starting to happen. Like, the surgery is not just like anything else. Like, if you come in and you're like, I'm not sure what I did, this is something that's been progressing over the years, surgery is not your option. You've got to get to the source. Other things too would be like even massage, and people think that like only massage will help, just like with any other body part. But again, if you don't get to the source of the problem, like, why is that tightening up? Now, it doesn't mean that we're not going to be doing a massage on people, but we're also getting to the source of getting things moving again, right? Understanding like where things are coming from. Mm-hmm. Yeah. So what are some of the things that clients are feeling and saying because of this? I think we went over a little bit at the beginning.
Yeah. So, common things are joint sounds. So hearing like that clicking or popping when you open your mouth. even if it's not painful, but a lot of times it is associated with pain. So we hear that quite often. And that's really just that disc kind of moving in and out of the joint, just like we have discs in our back, similar thing. And it's moving in and out because of a positional issue, which you need someone to evaluate and look at your mouth to really get down to the bottom of that. But and then other thing is
Headaches. Focus
yeah,
on headaches,
neck
neck
issues,
pain,
like all up through
Yeah.
here. Just soreness,
fatigue.
general soreness.
Yeah. The
Um,
fatigue from the neck pain and the low grade migraines that people get.
congestion all in through here. That can be deep, that's associated with upper cervical stuff as well. So releasing some of the upper cervical joints and getting those moving better, very closely related to the muscles in through the jaw. So those can refer into the sinuses, into the temple, headaches in the temple, very, very common. That temporalis
Into
Go
the
ahead.
eye too.
in the eye. Yep. But yeah, the fatigue, the chronic fatigue too, not sleeping well.
Mhm.
Your sleep apnea and TMJ are very closely related. So most people who have sleep apnea tend to have jaw issues too, which is because of our airway. Our airway can be a key issue with TMJ. So, and we'll get into that a lot more at our event.
Yes.
So,
Well,
yes.
let's go into a little bit of the possible
Yeah.
sources. I mean, we talked a little bit like their frustration. So we know some of the sources can come from the neck and
Yep.
other areas. So what are the sources of everything that we look for as possible sources for TMJ?
Yeah, so we're going to look at your neck and screen the position of your neck, the posture, of even into your upper back area as well, how you're holding your head. And then also in the jaw joint itself, going to assess that, how it's moving. When you open, your mouth should not like open and deviate to one side. So making sure that that's moving well. And then the airway, asking questions around that, making sure that you're breathing through your nose and you're able to breathe through your nose. You're not breathing through your mouth. Mouth breathing tends to be something that puts a lot of stress on your jaw. Having your mouth hanging open is putting your jaw in a different position. So that will make your muscles work differently and actually make them work all the time so that they're overactive, they're pulling on your joint, and we can get a lot of soreness. So I know that was kind of a lot, but just getting into the actual jaw joint and the positioning of that, looking at your bite, and then having a dentist look at your bite and assess that as well. So we can work really closely with a dentist if we feel like that's needed.
Yeah.
So there are a lot of really getting to the source of why are the muscles overactive? Why is your joint compressed? Because we can feel the soreness because there's less space in there and the disc is popping out. It's feeling very compressed. A lot of times it is because the muscles are overactive, causing the joint compression. But it could be a whole jaw positioning thing too. And that's something we can change.
Yeah. And it could be, not just one thing. It can be layers of things. So that's why it can get so complicated. It's why it's just say like, oh, do this and it'll fix it. If it were that simple, then we wouldn't have TMJ issues. People could just look up an exercise and it would work. So speaking of exercise, what are a couple of things that they can do to help their TMJ if they have it?
Yeah. So very basic is trying to find a resting position for your mouth where your muscles aren't turned on. And this sounds simple, but it can be very hard, especially if you have issues with this. So resting your tongue on the roof of your mouth with your lips together and breathing through your nose is something you can do just to kind of shut the muscles down, make sure that you are nasal breathing. And you'll notice that your teeth kind of lightly touch. That's the resting position. That's what it should feel like to have your muscles relaxed and your jaw relaxed. Now, if you can't get your tongue to the roof of your mouth and lie flat, there's probably not enough room for your tongue up there. And that's when we can get talking into other things that you might need. So that's one thing. Another thing is just some simple stretching for your masseter muscles and some other muscles on the side. You can actually stretch yourself So wash your hands, but you can put your thumb kind of up into the top corner of your mouth and just kind of squeeze your cheek and pull, and that will release that muscle. It doesn't feel great, but after you're going to be like, oh my gosh, feels amazing. And that's something that we do in the clinic as well. And then other things are just think about your posture. Don't let your head just sink forward like this. It's very heavy. So thinking about using all of the muscles in your upper back, in your shoulders, and not letting these ones in the upper neck take over. And those are just some simple things you can try.
Yeah. And I would say like another option, obviously, is if some of these things aren't fully resolving your issues, then find someone like our office that can really sit down and do a full evaluation, because we're trained to figure things out. That's what we do. You're the master of getting to the source of what's going on, and we can help guide you through that process, and you will get there so much faster. And we should be like the first stop, in my opinion, because so many people will spend so much money going down, trying all these things, like you said, like Botox and injections and medications and night guards and all these things. But are they really getting to the source of what's going on? Probably not. And you'll spend a ton of money doing that, not to mention the frustration of the doctor telling you there's nothing that you can do and you're just going to have to live with it. And it's just not true.
And even if it's just like a little soreness, like it's not bugging you too much, come in, we can give you a few things to work on, and like it will help you from having this pain in the future. So
because it's just going to get worse.
Yeah, you don't need to have pain for like years and years to come in. Just if you feel soreness in your jaw, there's something going on, so we should address it.
Yeah. And it will be a quick fix usually when you can do something like that versus waiting for it to like really affect your lifestyle and be like, oh my God, now I'm really dying. Like, let's not get to that point, because we can still help and give you tips as to why.
Yeah. And a lot of it is lifestyle changes too. Like while your jaw is inflamed and sore, like just try not to eat hard foods, simple stuff like that. Don't chew gum. Try to keep your mouth together and your lips relaxed, and breathe through your nose. Simple stuff like that.
Yeah. Well, awesome. I'm so glad we did this. I can't wait for people to learn more at our event. And if you want to learn more about our event, definitely I'll put some links below where you can reach out to us. And if it's beyond the time where we did it, we can send you the recording.
Yep. We're super excited. Can't wait to see you guys there.
Yep.